Welcome to StartUp Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm your host, Logan Plaster. My guest today is Meena Sandhu from Careteam. Meena, always good to see you in the studio.
Likewise. Great seeing you here again.
Okay, so Careteam occupies this space, this patient engagement, care navigation space. Can be a little hard to explain because it covers a lot of territory. So let's just start there. Explain to us what Careteam is.
Sure. You know, in its simplest definition, we do care plans. And we do care plans for complex chronic conditions.
Okay.
We really come into play for discharges and transitions. That's where some of the biggest gaps in care occur.
Okay.
And we fill in those gaps with smoother and better quality discharges and transitions.
So let's define it through an example.
Yeah, absolutely. So, the main thing that we're doing, the main added value is we are connecting the entire ecosystem around the patient.
Okay.
So I'll give you an example. Say you have an elderly parent or grandparent suffering with dementia. They enter the health system, they have numerous different specialists, they have family caregivers, a son, a daughter in different cities, different community support, they have their primary GP, they have their allied care.
So much.
It takes an ecosystem
Yeah.
to take care of a patient,
Yeah.
right? It's not a single physician, it's not a single team. So how do we connect that greater team? And we do it through our care plan platform. We
Okay.
bring everybody that needs to touch the activities to care for that patient into one place, into that care plan, so they can all communicate, coordinate, collaborate to the extent they need to.
Got it. So really expanding the idea
That's
of who
right.
the care team is.
That's right.
You think, okay, my care team is my doctor and my specialist.
Exactly.
But really, it's all the people who enable me to take care of myself.
That's right.
Give me
That's
some
right.
examples. I remember your co-founder, the CEO, Alexandra,
Dr. Greenhill.
Greenhill,
Yeah.
describing a scenario where it's like you may need to have somebody watch your child so that you can go to an appointment. There's all these
Absolutely,
different...
and that becomes a task. Or is continuing with the example of that elderly parent with dementia, how do they get to the appointment?
Yeah.
They can't drive themselves.
Transportation, yeah.
Who's taking care of that transportation? So you could have one child, grandchild, whoever it is, friend, that drives them. Or you could, through our platform, book an Uber for them.
Okay.
Coordinate at that level. And in addition to connecting that whole team, it's also really important that everybody knows what role they play and
Okay.
what are the user level permissions. You might have one child that's really actively involved. Another one, you want them to know a little bit less.
Okay.
Every family has their own dynamic,
Yeah.
right? And then same with the care providers, the clinical teams. Some are more deeply involved, some are less, more read-only just to stay updated,
Got it.
right? You need to communicate and
Permissions
connect.
levels.
Exactly.
Okay,
Permissions
okay.
levels are really important.
Interesting.
Really, really important.
And who's at the center of that? Is it the patient or is it the primary care doctor?
It's really their specialist,
Okay.
So whoever's in charge of their dementia and aging care, that physician and their clinical team is going to initially set up the care plan. They're going to invite the patient and their family representative that would be taking care of them, and then the patient invites the ecosystem in because
Okay.
they have control over their data. They decide who they want involved in their care.
But it's an important distinction that you've got a specialist at the center
That's
as
right.
well,
That's
guiding
right.
care. Some
That's
apps
right.
might put all the burden on a patient to
Absolutely.
say, just sign up your relatives to be helpers.
Absolutely.
And it's like there's not actually somebody helping with that through line
Yeah.
who is a specialist.
Exactly.
Talk to me about the company's just trajectory and traction. I know you had an interesting new partnership with Trillium. Tell me about that.
Yeah, Trillium is one of the larger health systems in Canada. So we're doing a system-wide implementation with them, starting with one specific use case, and then we'll move across the organization.
Okay.
So even though we are focused on complex care, a handful of different conditions, we can essentially fit an entire ecosystem. We're condition agnostic, but as you know, as a startup, you cannot put enough resources out there to go out looking for every single condition,
Yeah,
right?
yeah.
So we try to specialize our efforts over a handful of conditions. Dementia and aging is one of them. Pediatric type 1 diabetes is a fantastic implementation for us as well. We try to stay focused and gain traction like that, and we're really trying to grow the amount of customers that we have across the U.S., and that's our focus right now.
When you describe that idea of expanding the care team to include a neighbor or a loved one, it makes a lot of intuitive sense. Also seems like it could be difficult to validate the sort of monetary value of bringing that person in.
Yes.
Like
it's
it's
the
intuitive.
patient outcomes is a very clear value for the patient and their family. Organizations, health system, hospitals, they're businesses. So we need to still be able to meet their needs as well, in addition to them being able to provide better care.
So how do you go about doing that?
And how we do that is we're really having a significant impact on their capabilities. So one of our implementations has seen a 6x increase in the amount of patients they're able to see with the same amount of staff. No more hours, no more work. It's the same work output, but you're seeing so many more patients because of the added efficiencies of clear communication, no missed appointments. You can see reduced lengths of stay because discharges are smoother. You can see fewer readmissions, especially within that 30-day window where you can get penalized. There's also reimbursements that are applicable, and really understanding the reimbursements and navigating that. They change all the time. But understanding that value is something that matters to health systems.
That's interesting to me. I mean, it makes sense that you would find those efficiencies, but when you describe sort of the expanded care team, I think more of the outcomes based off of a patient's satisfaction and they're having a better experience because my friends and family know how to help me.
That's right.
But then to connect the dots from that to actually an efficient hospital experience is interesting.
It's so important to do, and there's
so interconnected.
We also like to say that we are trying to be that anti-point solution, because what happens for most organizations is you have the large EMRs and then you have a million point solutions, managing all of them, keeping them integrated, keeping them talking to each other and effective, and disrupting workflows in a positive way is really challenging to do. A lot of clinical teams will say that they're struggling with technology burnout. So Care Team comes in as this middle layer where we connect to the EMR and we integrate however many point solutions need to be integrated into our platform. So we take that responsibility and own us on us.
Interesting. Has that EMR integration been challenging? Where are you at in that process?
Well, it's always challenging. And it all depends on the EMR and how much integration they'll allow or not allow, and what information makes sense for us to share between the EMR and the platform. So it's always going to be challenging. The system's not built to be fully integrated. Otherwise, we wouldn't be in the situation of all these solutions out there. But we've made great strides. We connect with Epic. We can connect with Cerner, Meditech. So we're in a really good spot.
So you are generally sort of fully integrated with the major players. What's next? What should we be looking forward to in the next 12 months?
In the next 12 months, just look to see some names being announced as to who's coming on board as a customer, and we're really looking at and staying hyper focused and looking at ACOs and value-based care. That's where the ROI is really obvious and good alignment for us. So keep an eye on us and our product development. We're always happy to announce product updates.
Last question, do you get to hear success stories?
We do. We absolutely get to see.
Do any come to mind?
There's so many stories. I mean, success stories just in even family members of mine that have had the opportunity to use care plans and see them, and just being able to keep everybody in the loop, keep everybody informed, and especially stories from people with children with type 1 diabetes, to not have to be chasing for information and to keep their children well. The monitors are integrated, remote patient monitoring is a part of the platform, and fewer visits into ER, fewer visits to the hospital, and staying happy and healthy longer. That's really what it's all about.
I mean, the status quo before would be like a text chain,
Absolutely,
with a screenshot of my, glucose numbers.
That's right.
But I imagine in this situation, maybe I have an uncle who's a physician who I really want to see have some permissions.
That's right.
A glimpse into my
and
health.
a single click, a single single link, and they can have the access that they need.
That's really cool.
Yeah.
Well, Meena, love what you're doing. I love the whole team. I've gotten to know Dr. Greenhill and Rob over the years,
Yeah.
and so I wish you the best in the coming years. You continue to grow these partnerships.
Thank you. Thank
Keep
you.
up.
Always appreciate it.
All right.
Thank
Keep
you
up
very
the great
much.
work.
Thanks so much.